Hi, everybody. Welcome. So I'm Janine Rethi, Division Chief for Community Pediatrics and the Secretary for DC AEP. And we are really pleased to be here today presenting at your Georgetown Pediatric Residency Retreat. And just so you know, we are also streaming to our DC AEP members on this important topic and recording it as well. So today you'll be learning more about WIC, which is a critically important program that improves health outcomes for pregnant women and children up to age 5. We're really happy to be partnering with our partners at DC Health and DC WIC. And we're happy to welcome Sarah Beckwith today. She's the Bureau Chief for Nutrition and Physical Fitness for DC Health, as well as Melissa Siyum, a public health nutritionist with DC WIC. You will also be hearing from Colton Navel and Ryan Thick from Find Help. Find Help is a national platform to connect people to social services. They will be giving you some practical information about how to refer families to WIC, to DC WIC, and how to continue communication with our WIC partners after the referral. And to kick this all off today, you'll be hearing from Dr. Karen Ganesha, so I think most of you know well, faculty in the Division of Community Pediatrics, on this multi-sector effort with DC AEP, MedStar Georgetown Community Peds is a part of the Safe Baby Safe Moms program, DC WIC and Find Help to improve WIC utilization through this technological solution. And the lunch and learn that you will have in the second half was funded through the AEP Building Pediatrician Capacity to Address Food Insecurity grant. So thank you for being here and please enjoy.
Thank you, Dr. Rethi. So hello, my name is Karen Ganesha. I'm a pediatrician with the Division of Community Pediatrics at MedStar Georgetown University Hospital. I'm also one of the physician champions working on this particular project with the DC chapter of the American Academy of Pediatrics. This project has really focused on building a referral mechanism and means of communication between healthcare organizations to DC WIC. I do not have any financial relationships to disclose for this particular presentation. So as Dr. Rethi said, I am going to start this 1-hour discussion with a short introduction, just describing the background behind the project and broad overview. Then we'll have staff from DC WIC, so the Fitness and Nutrition Bureau Chief, Sarah Beckwith, and Melissa Siyum provide more detailed information on DC WIC and its importance. And then lastly, we'll have Colton Navel and Ryan Thick, who's available virtually. They're both customer service reps with Find Help, talk about the referral mechanism and means of communication that we've utilized through our MedStar Georgetown University Hospital electronic health record link and DC WIC. And then we'll hopefully have some time for questions at the end. So to start, I'm going to briefly review what is WIC, though Sarah and Melissa will be giving you more detailed information shortly. So WIC stands for the Special Supplemental Nutrition Program for Women, Infant, and Children. It's a federally funded but state-run program that provides nutritious foods, nutrition education, breastfeeding support, and referrals to healthcare and social services to low-income pregnant and postpartum women and infants and children up to age 5. WIC's effects on child health measures such as birth weight, infant mortality, diet quality, the initiation and duration of breastfeeding, and cognitive development and other measures has been extensively studied and was well summarized in a report from the Center on Budget and Policy Priorities written by Stephen Carlson and Zoe Newberger and updated in January 2021. And from that summary report, it stated that women who participate in WIC give birth to healthier infants by increasing the average birth weight and reducing the incidence of low birth weight and very low birth weight infants born to women who participate in WIC versus those who do not participate in WIC. Additionally, children who participate in WIC have nutritious diets, so they eat more fruits, vegetables, whole grain, and low-fat dairy products. Children who participate in WIC have near optimal exposure to iron-rich cereals and limited exposure to energy-dense, low-nutrient foods. And those children who participate in WIC through their 4th year have better diet quality as measured by the Healthy Eating Index score than those children who leave WIC after their 1st year. So as the title of the Center on Budget and Policy Summary Report stated, WIC does work in addressing the nutrition and health needs of low-income families. Yet despite the over 4 decades of research on WIC's effectiveness, it is an underutilized program. This map shows what WIC coverage looks like nationally. This is the most recent information that is available from the USDA, and coverage rates are the percentage of individuals who are eligible for WIC that are enrolled and receiving WIC benefits. So you can see that nationally, that of those that are eligible, 57.4% have coverage, meaning that they have been enrolled and are receiving WIC benefits. To give some context to this number, SNAP, which is formerly known as the Food Stamp Program, is also a federally funded program that provides nutritional support to low-income families. In 2019 as well, 82% of individuals who qualified were receiving SNAP benefits. And there are variations by state, so Melissa and Sarah will go over the coverage rates in the District of Columbia, which is higher than the national average. But just nationally, WIC coverage rates are suboptimal as compared to what a federal nutrition program can achieve. And when you look more specifically at demographics of eligible participants covered nationally, you see that infants have a high coverage rate at 98.4%, followed by postpartum women. But coverage rates for children at age 1 are less optimal, and coverage rates fall as the child ages from 1 to 4. There are several studies that have looked at reasons for underutilization of WIC, and studies that have specifically looked at families with children age 1 and above and their utilization of WIC. However, the background to this particular project was the recognition that the period of childhood between 1 to 4 is a time period when pediatricians have more interaction with the family clinically than any other specialty and arguably any other medical profession. So was there something that could be done to optimize a pediatrician's interaction with eligible families, to focus on this gap of WIC coverage noted for eligible children ages 1 to 4? The American Academy of Pediatrics in 2020 solicited input from local chapters on projects that could address this issue. More broadly, this particular grant funded by the AAP focused on improving food insecurity screening and also referral mechanisms to state food delivery programs. Through this project, the DC chapter of the AAP focused on building a better collaboration with DC WIC, understanding that there was an underutilization of WIC resources, but that WIC was beneficial. And in attempting to identify how best to refer eligible families seen in a pediatric clinic who have children within that age of gap coverage, we considered a few items. To refer a patient to DC WIC to connect eligible families with services that they could benefit from, we needed a referral system that was shared by DC WIC and by health systems. This referral system had to be able to securely send protected health information in case WIC needed the birth weight, they needed subsequent weights, or they needed other vitals that the health system had for their own tracking purposes. And we needed a platform that could be tailored should we need to change something from the health system side or from DC WIC's perspective to make integration of the referral process more navigable in the clinic workflow. And we came to, in multiple discussions with DC WIC, that there was a shared platform between MedStar Georgetown University Hospital and the wide MedStar entity and DC WIC, and that this platform is called Find Help. So Colton Navel and Ryan Thieke from Find Help are going to go into more detail on what is Find Help and how you can make referrals, especially to DC WIC. But here you can see what the Find Help referral system looks like in Cerner, which is the electronic health record system used here through MedStar. It shows that you can actually search for WIC through this platform in Cerner and can directly refer to local agencies of DC WIC. And there is also an ability to track referrals made should you want to follow up with the families that you did refer. And this gives you a snapshot of what that referral page might look like for you. So this does end my portion of the talk. If you see on the slide, this is being offered for CME credit. So if you scan the code, you can get CME credit. This is but one slide that you'll see because each presenter will have the same slide so that you can claim CME credit after each talk. But my portion was really just meant to be a broad overview of how we came to this particular project. You're going to hear more detailed information about the WIC program from DC WIC staff and about Find Help from the Find Help representative shortly. But what I want you all to focus on during this talk, which is the crux of this project, is that WIC is a beneficial program for eligible families. It is underutilized, especially in populations that pediatricians see relatively frequently, and that there is an easy way to refer families seen to DC WIC. And so now I'll pass it on to Melissa and Sarah.
Great, thank you, Dr. Ganeshius. Again, my name is Melissa Siu. I'm here to represent our DC WIC program, and I'm going to expand a little bit more on Dr. Ganeshius' overview of the WIC program. Okay, disclosure here, I do not have any relevant financial relationships to disclose with ineligible companies, and I do not intend to discuss any unapproved investigative use of a commercial product or device. Okay, so in my time, I want to cover for you all what is WIC and a little bit more on why WIC, which I again think Dr. Ganeshius, you gave us a really good overview, some of the research and why we do want to promote this program for all who are eligible. And I'm going to talk a little bit more about who specifically is eligible and how these people can apply for the program. Okay, so once more on what is WIC. WIC is the Special Supplemental Nutrition Program for women, infants, and children. That's where that WIC comes from. That aims to safeguard the health of low-income women, infants, and children up to age 5 who are at nutrition risk by providing these 3 benefits. And we're going to look a little bit more on each of those benefits. The first one being nutritious foods to supplement diets. 2, information on healthy eating, including breastfeeding promotion and support. And then our third benefit here is referrals to healthcare. Okay, so looking at the first benefit then, nutritious foods to supplement diets. All participants in our program receive monthly food benefits from us in the form of EBT. So they get a little debit card that they can go to the grocery stores, they can use to do their shopping. And what I think is important to note here is that our program gives benefits in an itemized format. Okay, so we don't do cash value benefits, say in the way that SNAP does. Every item that is going to be on their card is going to be an item that has different specifications behind it that makes it eligible. Approved foods are sources of WIC target nutrients. Talking about how to identify those WIC target nutrients, it's its own presentation in and of itself. So what's important to note here are just what our current target nutrients are for the program. We have iron, calcium, magnesium, potassium, zinc, vitamin A, folate, folic acid, vitamin D, and fiber, which then means these being our target nutrients, the foods that you see in the box in the yellow are currently foods that are authorized in our program. So participants, there's to an extent they can tailor which items they receive monthly, but they get to choose from, they'll have most of these foods listed for them. So breakfast cereals that are mostly iron fortified and a source of whole grains, beans, peas, lentils, and peanut butter. Our participants get to choose monthly from an option of whole grains that can include bread or oats, pasta, rice, tortillas. We offer cheese. We offer soy alternatives to dairy, so tofu and soy beverage. We provide milk, eggs, 100% juice, yogurt, canned fish, and fruits and vegetables. So I will note here that although most of the foods that we provide are itemized, the benefit for fruits and vegetables is a cash value benefit. So on that card, they do get a certain dollar amount that they can go to the stores and purchase fruits and vegetables. And those fruits and vegetables can be fresh, frozen, canned, dried, they can be organic. Really, it's open up to them to purchase these. There's not too many restrictions behind it as long as it's a plain fruit or a plain vegetable. Right, and so that makes sense for our women and for our children categories, but we also serve infants as well. So kind of on the bottom half here, you'll see the different foods that we also offer monthly to our infant participants, which we'll talk about breastfeeding promotion and support because that's a big pillar for us, but that's hard to go to the store and purchase. So we've got infant formula, infant cereal, infant meat, infant fruits and vegetables that can also be included as their food package. Okay, so benefit number 2 then, this is my baby. This is all about nutrition education. So for each participant that comes into the program, we provide tailored nutrition education only after a full nutrition assessment is completed for them. And it's important to highlight that point because the method that we use in conducting the nutrition assessment is considered participant-centered, which just means that we want to make sure that we are just finding topics that are relevant for our participants in hopes that it leads to behavior change. I also want to note too that all of the education content that we provide in our education points to participants are sourced from federal partners and reputable agencies and organizations. I've got some of the ones listed here that we frequently source from: the American Academy of Pediatrics, American College of, I was going to mess this up, Obstetricians and Gynecologists, thank you, the Center for Disease Control's Prevention, and the Food and Drug Administration. And here I really want to pause and talk about the next point, which is the resources we have for breastfeeding promotion and support. At our basis, anybody that you interact with in our clinic is going to receive basic breastfeeding training, which means if somebody comes through the door, be it somebody who greets you at the front desk or you pick up the phone, you have a question, they're going to be able to tell you something about breastfeeding, but it doesn't stop there. We have different resources that we also use to promote breastfeeding within the program, and one such is our peer counselor program. And I wanted to highlight this because the peer counselor program sort of runs an adjunct to the WIC program. And what I mean by that is when a participant comes into our clinic, most of the staff that they have a relationship with is professionally. Okay, so I'll do the nutrition assessment and, will help to give you the resources that you need. But where the peer counselor model is a little bit different is it's not necessarily a professional relationship, but it's a peer-to-peer relationship. So they're able to connect with our participants and give them education in a way that's slightly different from those who operate in the clinic. And so all of the clinics in DC have the peer counselor program running and active. And here I'll also go through our last 2 points on our breastfeeding is, although all staff receive a base level of education, we definitely have a larger curriculum that those who are interested and eligible for can go through to be designated as the WIC designated breastfeeding experts, which is our DBEs. And so that's sort of the highest level that the WIC training can provide for our staff in the clinic. But we know that sometimes participants have needs that even our DBEs would not be able to address. And so it's important for us to make sure we have resources for our participants who need that highest level of lactation support. And this is where I also want to highlight our Pacify app. It's something that the DC WIC program offers to our participants. It's 12 months free access to 24/7 access to lactation professionals. So the IBCLCs, those international board certified lactation consultants, if a participant needs assistance and if something happens over the weekend or after hours when WIC's just not available, this is a wonderful app for them to go on to use and get connected to a professional resource to give them that assistance. Okay. And so for our third benefit here, referrals to healthcare. So WIC works in coordination with a patient's healthcare team. What I've got listed up here on the slides are common referrals that we make for our participants, though it's not at all an extensive list. Some of the common referrals that we make include those to adjunct eligibility programs. This will come up in a couple of slides again, but some of the examples here are SNAP and TANF, only meaning that if you qualify for WIC based on income, you likely qualify for these other programs too. So we make sure to get them connected to those services through a referral. Dental care is also very popular, so we make sure to connect with those. Breastfeeding support, as I've mentioned, and we do quite a bit of referring back to the healthcare provider. In our program, we make sure to screen for immunizations and making sure they're up to date on immunizations, lead screening too for all of our participants age 2 and under. And so if it's identified that maybe they are behind on their immunizations or if they're unsure of their status, that's an automatic referral back to the healthcare provider to have that conversation. And the other point I have down here too is specialized infant formulas. So we prefer that conversation to happen and have it starting place with the healthcare provider if we pick up on perhaps the infant may need a different formula. And so we're sure to loop in the healthcare provider at any point that conversation is going on. And there's so much more. And so a little bit more on the why do WIC? Again, Dr. Ganesha, thank you for the overview. Some of the points that you've already made, I'll just go through once more. Improved birth outcomes. So we know that those who participate in WIC give birth to full-term healthy babies. Improved infant feeding practices. So the education that we provide help families to make sure that they're storing formula properly and or breast milk, sanitizing bottles correctly, and they know how to mix formulas based on the dilution that either label requires or their healthcare provider has stated. Improved cognitive development, improved diet and diet-related outcomes. So we also know that those who participate in WIC have a better quality of diet with different food groups and higher intakes of fruits and vegetables. Those who participate in WIC have higher immunization rates and regular source of medical care. And those who are pregnant have improved preconception nutritional status. And again, there's so much more that goes into this. So even underneath all of this, I have ... other improved outcomes, improved growth rates, and increased likelihood of children having regular provider of medical care. Okay, and we're going to swing through the eligibility criteria. There's 4 eligibility items that the participants need to demonstrate in order to receive our benefits. And the first one here is being categorical. So anybody who wishes to receive the WIC program has to be one of these 4 categories, either pregnant or experience recent pregnancy loss. That's one that not too many people know about, but we do have women who either while they're pregnant or even if they have recently had a pregnancy loss, they can receive services to us up to 6 months after the fact. Women who are postpartum, that includes both breastfeeding and non-breastfeeding mothers. Non-breastfeeding mothers are eligible up to 6 months postpartum, and those who are breastfeeding can continue with WIC services up to 1 year. Infants and children up to age 5. My little asterisk here is because the infants and the children under age 5 aren't the ones picking up the phones to make an appointment. So we encourage their caregivers to apply on their behalf. Okay, and we are an income-based program, so our cutoffs are updated annually. We do follow the federal poverty guidelines, and our income cutoff is set at 185% of that value. That, again, is updated annually. Proof of that, so that's the most common way that we will determine income, but there's other ways too that we can deem our applicants income eligible. And one such way, again, is that adjunct eligibility program participation. So if an applicant can demonstrate to us that they are currently receiving SNAP or TANF or the National School Lunch Program, we can take that proof as proof of income and then deem them eligible for our program. Foster children are also unique. For them, we consider them automatically income eligible as long as, again, they're under the age of 5. The only stipulation with that is that we do need a letter from social services. And I also wanted to highlight this down here too. For our program, we understand that sometimes presenting this proof might be difficult just based on circumstances. And so we do have policies in place to ensure that our services are still in place for participants who would otherwise be eligible. So just think of those who might be homeless, migrants, those of refugee status, or recent immigrants to the area. And then our last eligibility criteria is that of residency. This one's pretty straightforward. If you would like to apply to the DC WIC program, you have to live in DC, with only one special case being noted here, and that is that of foster children once more. And so how it works for us is that if you have a foster children who lives outside of the district, but yet they still receive primary care in the district, they would be eligible to receive our services. Okay, and then the last eligibility criteria to highlight here, and this one I think is fun, it is the nutritional risk. And why this one is a little bit different from the other 3 is because we don't necessarily ask the applicant to demonstrate this to us upon their first documents to bring in. So we work with them to determine nutritional risk. And it's important to note that that nutritional risk goes back to the nutrition assessment that we conduct for every applicant, and or it can be identified by a healthcare professional. So we generally categorize our nutritional risk as either medical based. Some examples are listed up here: preterm birth, gestational diabetes, GERD. And I wanted to note that medical based risk can be self-reported but cannot be self-diagnosed. And we make sure to ask clarifying questions if we have suspicions. The other category is diet-based. So some examples of things that we might note for the participant would be if they're consuming a diet low in calories and or essential nutrients. Other risks that could fall into this would be consuming too many sugary beverages or not practicing safe sanitation of, say, bottles and bottle parts. Okay, and so applying for WIC, and I will, again, go through this briefly because I don't want to take too much away from Colton's presentation. But on our homepage, if you go to dcwic.org, you'll see a big old red button here that says to request an appointment. So it's simple enough to go ahead and click on that, and then you're going to be brought to this page. And here on this page, we've got our 4 organizations listed out right here. And the applicant may choose any of these organizations to apply through. So typically, persons either want to go to an organization that they're already connected with, say they're already receiving medical care from, or they might select a location based on where they live or where they work, and they have the freedom to choose that. So after selecting which of the agencies they would like to make an appointment through, they are then brought to a different website on LinkU to complete the appointment request. And so here's another screenshot of what that looks like. Our participants would then just click on that apply button, where they are then brought to the request form, where they're just asked to provide a little bit more information. They can go ahead and submit. Once submitted, their information is brought on over to the agency, and the agency will follow up to schedule the appointment. Okay, but that's just one way to apply. As Dr. Ganesh has highlighted earlier, we know that there's a gap in coverage, and so truly any way that people would like to reach out to us, we try to make ourselves available. We have our main administrative office number listed up here that they can give us a call. They're also welcome to call the agencies directly. So we have all of their phone numbers and addresses and hours listed on our website so that they can, again, either choose to call directly, or on bullet number 3, they can just show up. We encourage them to walk on in as much as possible. We do try to accommodate same-day appointments when the schedule allows. And so I just leave us with a call to action. We do need your support. Providers are crucial, trusted sources of information for our participants. Referrals from healthcare providers can help DC WIC close the coverage rate gap. So you can see here our average is slightly higher than that of the national average at 57.9%, but there's still a whole bunch of people out there who are eligible for our services who are just not making their way through their doors for whatever reason. But we hope it's not because they don't know about the WIC. So we ask for your partnership in helping to get us out there and let us be known to those that you serve. And so here is that evaluation form again. Thank you guys so much. And I'm going to welcome up Colton to take us through Find Help and LinkU.
Okay, good morning, everybody. So, get this going. Thank you, Melissa. Okay, here we go. So, it's a pleasure to be here this morning with you all. My name is Colton Naval. Before I get started, I'm just going to disclose that I'm an employee of Find Help, which is the company that underpins the referral platform that Melissa and Karen were talking about earlier. However, Find Help is not considered an ineligible organization for the purposes of the work and participating in the CME offering. So with that disclosure out of the way, I will kind of move through and talk through a little more about the ins and outs of the referral platform that we've heard about. So here's that disclosure. Nice. Thanks for including that in there, Keith. So I'm just going to give a brief background on, who Find Help is and how it kind of all interrelates with MedStar and DC WIC. So Find Help as a company was really founded on our mission of connecting all people in need and the programs that serve them with dignity and ease. It's really important to find help that any person who's in need of assistance can easily find those services that provide those like assistance, and that they also deserve the dignity of a response to those requests. So with that, Find Help was created as basically an online social care program directory and referral platform. Now, the MedStar Health Social Needs tool is powered by that platform. So while a lot of what we're going to be seeing today is going to be MedStar Health specific, MedStar branding, just know that it is tapping into the Find Help network and the Find Help platform. So when we're talking about Find Help and more specifically the MedStar Health Social Needs platform, really you are tapping into a nationwide network. So whether that's DC, Maryland, Virginia, Alaska, Hawaii, all you need to do is type in a zip code and click search, and you can find those social care programs anywhere throughout the country. So as you can see here, we have more than 29 million users. In fact, I think we've surpassed 30 million at this point, and we have more than 600,000 program locations across the country. So quite a wide network of programs and services reflected on this platform. The one thing to kind of underscore here is that the sort of MedStar Health Social Needs platform is available to both MedStar staff as well as patients. So there are 2 entry points, one specific for staff, one specific for the community. And really it's meant to help coordinate that social care record, as well as open up the ability for a patient to directly self-navigate and find those programs on their own. There are a couple of different entry points. And I think the one thing I want to emphasize here before I kind of keep going is that Find Help, we kind of consider ourselves as like a house, right? There's no wrong door. Every entry point that we're talking about here is an entry point into that house. So you can think of this sort of MedConnect entry point as one window. You can think about those different sites that I was sharing here as other windows. And the site that Melissa was just sharing, that Link You site, as another window. It all taps into the same house though. So even if you're using different access points, that information is still connected and coordinated. So I just wanted to kind of emphasize again that there are different windows into the house. This is one, Karen mentioned this earlier, but you can directly access the Find Help network through Cerner, through your Cerner login. You can also go to that web browser. So those 2 sites that I was just sharing earlier, you can use those to directly access the platform, log in, and all that information will still be coordinated between the records. And then access via Link You, which is the platform that DC WIC uses. It's the platform that Melissa was just sharing with us. And if you go to the website, you'll notice again that you can click on any of those logos and get taken directly to the Link You platform. Emphasizing here again that no matter which sort of platform you're using, it's all going to kind of sync together. So I'm going to talk a little bit more specifically about the process of applying. I'll also note that these slides are going to be available after the presentation. Lots of great stuff in here, lots of great links. If ever you're lost or don't know where to go to access all the different DC WIC programs, this slide has direct links to each of those specific programs here. So we have those 4 local agencies. To make the kind of process easier, you can also create these free save favorites folders, which really allow you to directly go to your own folder of resources. I have a link here that shows how you can create those, but a great kind of way to keep all of these programs together is to add them into your own little folder on the platform. So what I'm going to talk through here is the kind of specific referral workflow and what that looks like to apply. I'm going to kind of hop over and jump out of these slides. And I'm going to go directly to the MedStar Health Social Needs platform here. So one of the things I want to emphasize is that you don't necessarily need to create an account to browse and search for resources. We don't want that to be a barrier, especially for patients, to go and, okay, I got to click here, and then I got to go and find help. You can actually go into the platform, use it without needing to log in. I'm already logged in so I can show stuff to y'all, but I wanted to kind of underscore that you don't necessarily need an account. I think for everyone in this room, though, it's very important that if you're using the site, you should create one because it's going to help you track that kind of patient record and that referral. It's also good from a data kind of tracking perspective. So encouraging y'all to create accounts when you're using this site. Know that if you're working with patients, they can use the site without logging in. So I'm already logged in. I'm going to hop over and I'm going to do something a little different here. I don't want to make a real referral to WIC. What I'm going to do though, is I'm going to show you what that process would look like to search for the service. So if I type in my zip code in Columbia Heights, I can see here that there are a little over 3,300 programs available specific to that zip code that I've typed in. So again, this program number is reflecting that specific zip code. From here, I can go to this search bar and type in, the name of a program, the name of an organization, keywords. I can also use this to type in a new zip code. I can also use these little icons up here to start kind of browsing and having a more prompted search for different services. I'm just going to go ahead and type in WIC right here, and I can see that we already have some top matches for those WIC programs. This is just another way of getting to these programs, in addition to being able just to click directly on the DC WIC webpage. But I can see that the Unity Healthcare, Mary Center, Children's National, and Community of Hope are the first 4 results that pop up, which is what we'd want to see. And I can start that process of reviewing the information and beginning the application. So I wanted to show this just to kind of underscore how you can, type in a zip code and search for services. What I'm actually going to do now is let's pretend that we've already clicked on that DC WIC program. I'm going to show y'all what this looks like. It's a very similar kind of workflow. Just note that this isn't actually going to WIC. I don't want to compromise y'all's data necessarily. However, a process with which you'd apply for those services would look just like this. You would click on that link. You would be taken to a kind of a full page view of that specific agency's WIC program. And then you just click apply right here. Now, one of the benefits of this sort of referral platform is that all of that eligibility criteria that Melissa was emphasizing for WIC services will be called out here, as well as directly in the screener form. So what that means is, let's say that I'm referring patient, we'll call him Mr. Willie Find It. I already have his info on file, so it's going to kind of auto-populate down here in a second. But if it was the first time I was connecting that patient, you would just fill in their information here, their preferred mode of contact, in this case, email. One thing to emphasize here is that you can actually translate not just the referral, but the whole website into over 100 different languages. So if I was helping Mr. Willie and he spoke Spanish, I could make sure that this message was sent to him translated through the site into Spanish. So when he gets that notification, it'll be automatically translated into Spanish. In addition, that patient will receive a link to the program, and the website will go ahead and translate into that language too, which is just another kind of easy way to help meet that person with dignity and ease. I'm going to go back to English. I can add comments here too. So if I know that, Willie, well, I guess Willie in this case, Willie's wife is expecting, and he works 2 jobs and may be slow to respond, I can put that message right here, and it's going to be visible to everyone involved in this referral. So just kind of keep that in mind if you have specific situations or circumstances that you want the WIC agency to know about that specific patient. Importantly, too, we want to confirm that we have Willie's consent. So Find Help is HIPAA compliant, FERPA compliant, and high trust certified. We take that privacy and security of personal information very seriously. So not only do we require consent for every referral made, which means that even if I've referred Willie to Community of Hope's WIC program 10 times, I would still need his consent every single time. In addition, we don't sell information. I myself, as a Find Help employee, can't even access personal information on the site. So just want to kind of underscore that privacy and protection piece as well. Once we've confirmed the consent of the patient, we can click next. The important thing here is to wait for the page to load. I can't tell you how many times folks are like, okay, it's done. With the screening process in particular, it can take a few seconds for it to load. It's important that you wait for it to load, because if you navigate out of this, it's not going to allow you to go back in and fill out this screening application. So again, note that I'm showing this all to you in our demo program. WIC the WIC screener is going to look different. The questions are going to reflect back all of that eligibility that Melissa was calling out. But in terms of the kind of what the form aesthetic looks like and the process of kind of filling it out and submitting, it's very similar. Again, you can translate the form too into any language. So if we wanted to look at Arabic, it will automatically translate into Arabic. At least the form will. And then now I lost English. There we go, back to English. So it's pretty fast, the translation. From here, it's going to ask us different questions. And again, the WIC questions are going to look different. I'm just going to go through and answer these really quickly. Also, we are going to say 123 Main Street. I will say Washington, DC. I'll put my zip code in. You'll also notice that on the WIC screeners, you'll have the option to upload those different documents that Melissa was mentioning in terms of eligibility. So things like prescription, medical notes, any sort of supplementary uploads that you'd want to provide to the WIC agency that they need, you can upload directly into the form as well. Request for services. From here, you're just going to click review and submit. You'll have a chance to look over your responses. You can edit them if you need to. Otherwise, you'll click submit. And at that point, the referral and the screener has gone to the WIC agency. And now they can have the process of following up with that patient to connect with them about getting services. On y'all's end, what you would want to how you would want to go in to look at the different referrals you've been making to WIC and other providers would be going to this people I'm helping. So anytime you make a referral on the platform, it's going to track for you in this dashboard called people I'm helping. And from here, you'll click that and it's going to pop open a page like this. These are all fake people. These are all our demo people. So none of these are real patients or clients. From here, you can type in the name of that patient. So I got Willie, and I'm going to pull up Willie's profile. What is cool about this is that I like to kind of call this sort of case management light, because you can add goals, you can update personal information, you can add context about Willie's household situation. If you were helping Willie apply for jobs, there's places for you to upload things like a resume or a W-2 so that you have all of this stuff in one place. But I think importantly, for the purposes of the referral, any referral you make for a patient will be tracked under this navigation history bar. So I'm going to scroll here and we're going to see that food pantry referral that I just made for Willie right here with a corresponding status update. As you're sending referrals to WIC, you're going to notice that those referrals are going to be updated. As those referrals are updated, it's going to sync for you, the agency, as well as WIC. So what that means is that any point here where you can update a referral status is going to update for the entire record of that referral for everyone involved in the referral, which really is just like a long and complicated way of saying like everyone's on the same page about the outcome of the referral. And each place a referral is tracked, those are the same places that you can go and update the referral, whether that's you following up with the patient and knowing they got services, or whether it's the WIC agency themselves who followed up. And maybe they said that, oh, well, we couldn't contact, right? You'd be able to see that status update directly in that referral. And you could even follow up directly with that WIC agency by creating a note, making that note visible and saying, why were you unable to contact Willie? Or, probably a better example would be, not eligible. And then you could say, why was Willie not eligible for services? This will be shared with the agency. Ignore the typos here. You'll click save, and then that will be visible to everyone involved with that referral. Likewise, the WIC agency could refer right back or make a note right back. So they could say, phone was shut off or something like that. And then you have this kind of bidirectional communication pathway directly in the referral in your people I'm helping dashboard. So kind of spent a lot of time today really zoomed into the specific sort of what the screener process looks like, how you can apply for WIC, what it looks like to kind of track the referral status, update the referral status, and make notes and communicate back and forth with each agency. Just note that there's a lot of other really cool stuff that you can do in this site. Again, there's all the programs you can search for: housing, transportation, food pantries, legal help. In addition, as Melissa had mentioned earlier, there are a lot of really cool analytics you can leverage. I don't think I have time to kind of cover all that stuff. Just know that in addition to kind of being able to have this pathway to refer to WIC, you have a lot of options and a lot of different functionalities of this platform that you can utilize when helping your patients. The other thing I'll mention is that I have a bunch of slides in here that are really meant to be kind of reference material for after today. So if y'all walk away from today like, I don't know what the heck he was talking about, you have this presentation. I believe this is also going to be recorded, but the slides in here have links. They have our support portal information. They have screenshots of the referral process. I'm going to keep going here. So, oh boy, these are all the screenshots. I'm going to keep going. So yeah, as you can see here, a lot of fun stuff. What I want to leave y'all with though is basically, you know, who we are and how you can get in touch with us if you need any assistance. Pleasure being here, and hope that y'all find this tool useful, and hope y'all get those referrals going to those different WIC agencies for your patients. So thank y'all. Appreciate it. And I think, oh yeah, and then the evaluation form QR code is.
So thank you again to Melissa and Sarah and Colton and Ryan. Thank you for being here and for helping with the presentation. To Keith, to Dr. Rethi, the DC chapter of the American Academy of Pediatrics, to Dr. Chawla and Dr. Hawkins and the PEDS chiefs, Dr. Magaziner and Dr. Mistakalis. Thank you so much for coordinating the lecture. From this 1 hour talk, the takeaway that I want you to have, just to highlight one more time, WIC offers nutritious foods and breastfeeding support to eligible families, and that the largest gap in coverage is a pediatric group that pediatricians can reach. And that if you identify that a family could benefit from WIC but is not yet enrolled, there is an easy way to refer, which is Find Help, which is integrated into our Cerner system. So please just consider that, look into it, and look into this referral process too. Thank you so much. And I think we have some time for questions. Yes.
I have some patients saying they get like hemoglobin and lead testing done pretty quick. Is there a way that we'd be able to follow up on those from like this pathway?
Yeah, so I'm going to repeat your question for the people that are online. So the question was, he had heard that some of his patients are getting hemoglobin and lead testing at WIC. And is there a way that we could get access to that too? Yes, that's what the bidirectional communication pathway is about. And I will say, if you try this platform and there are hiccups, please let me know, because it's still an ongoing QI process. But we're trying to figure out, is it best to do a screenshot and then they upload that into a document so you can see the actual value? Or can you put it in comments, perhaps, what Colton showed you, where they write, this was the hemoglobin, hematocrit, and lead that was taken 6/19/2023. Then you have it that way. It is a bidirectional communication pathway. So yes, that was one of the intentions for this. Thank you, Bader. Any other questions? There might be a question in the chat.
So we had screenshots of this before, but this is our website, and I mostly talked about the request appointment button that again takes you through that process to complete a scheduling request. The other red button that we have on here is also very helpful, so I did want to take some time to show you guys this one as well. It is the how to apply for WIC. Clicking on that takes you on over. Oh, how do we get this thing off of here? Oh, here we go. Okay. To a pre-screening tool. Did it go? No. Okay, I'm just gonna click here. And it's gonna take me. Okay, sorry. Very cool.
Yeah.
Oh, okay. Mhm.
Nice.
Wow, everybody's learning today. Okay. This is helpful too. So recall that I said that there's 4 eligibility criteria all applicants need to meet. For those who are unsure, the truthfully, what happens is a lot of people are may know that they qualify based on category, based on residency, but the income one is the one where we definitely get the most questions. It's helpful if you go straight from dcwic.org to this pre-screening tool. You can go ahead and click on this Get Started, and it'll help you to determine some of this before you go on to those next steps of actually requesting an appointment. The thing that's helpful about this pre-screening tool is it's hosted from the USDA, from FNS, which is the Food and Nutrition Service, which oversees our program. And recall that I said that those guidelines, income guidelines, are updated annually. They make sure to reflect that in the pre-screening tool. So it's also helpful to say if you're having conversations with patients and you may think that they would benefit from our services but are unsure of income background, this is a great place for them to start just to learn a little bit more, and then for them to also go through the process themselves to see exactly who would be eligible for our program.
And this is a great way too, if you're not comfortable with asking the hunger vital signs, do you feel like you don't have enough food at the end of the 12 months? Or do you feel like you need more support or more access to food in that 12 months? I know it's hard to ask those questions when you only have maybe 10 to 15 minutes with a patient, if there's no screener beforehand and they feel uncomfortable. If they bring up that they're breastfeeding, mom says, yeah, I would like to breastfeed my baby, I'm having some issues with that, really like to speak to a lactation specialist. You could also say, well, did you know that there's a program called WIC? They do offer breastfeeding support. Oh, what is WIC? And then talk through that, and then kind of gather a little bit more information to see if they're eligible. Sometimes what I do, I mean, we work in community peds, but sometimes what I do is I look at the insurance. If it's a DC Medicaid, more than likely they will qualify for WIC. So if you see that and they're coming in to see you and they have questions about breastfeeding, or even how to introduce solid foods, that's coming up in your Bright Futures, and they want more nutrition support, that's a great segue to talk about, oh, well, have you heard about WIC? They offer some nutrition education. Here's what the program is like. Would you like more information? Would you like a referral? Would you like me to put in the referral for you? That could be kind of the flow that you take or consider. Do you guys have any questions about that? Or like concerns about how that might work in your clinic?
Are you guys having a conversation with them? What's a good way that you have it that works for you? Start a conversation.
And what I also think that I like, I'm going to try to stand near the, hopefully they can hear me, is that they do refer to other social services, kind of similar to what the community peds department does. And granted, it's a different case management, but I think that I've had that question before. You have a lot to do in your visit. How do you follow up all these referrals that are you making to these different community agencies is tough. So like my recommendation was maybe you choose a community-based organization that you can build a rapport with and have them go from there. So that is an opportunity for you too. So really like the purpose also of this talk was just to say, WIC offers a lot. And if you're looking for that entry point to help your patient, it might be through WIC, because they can try to follow up and then communicate back with you.
Great. So this is great because it allows you to also select where you live. So if we go to look for the District of Columbia, and then that takes you on over here. So those are the adjunct programs that we were talking about before. I will say one of our caveats is Medicaid is normally one that we would consider an adjunct program. We just at the moment do not have like a checks and balance in place because some of the income cutoffs for Medicaid are currently higher than what we could accept at WIC. So we don't at the moment advertise it as one of our adjunct programs. But that may not be true, say, if you've got patients who maybe live in Virginia or Maryland or elsewhere. So from here, you can just select one of these, we go to continue. And then household size, I mean, this is also too where I think when you start determining income can start to get a little fuzzy for people. And also we definitely, this is a point normally for us. When screening for eligibility, we have to ask some clarifying questions. And so this is also where it's helpful for people in their own time to kind of go through and go with some of these leading questions, because household size, can we've seen any and all scenarios of like, oh, but this is my permanent address, but I'm staying here with a family member, or I don't have a fixed address at the moment, or would you consider my grandmother to be counted as my household size because my mom helps to pay for her even though she's living with me? So you can see it this kind of gets into a tangly gray area. And so as much as we can, that's where that conversation is helpful to work with a staff member and to help determine that. But this is also a good resource too for them to start thinking through some of those questions. And so I believe with that, this would also too, it looks like it's listing out a lot of the documents, which again is mostly just those three: a proof of residency, a proof of income, an ID. So I don't actually talk about that one that much, but we do ask for ID in order to apply for our program. And so that would be something else we'd ask for them to present at the time of their appointment. And again, these are just those two buttons right here on our homepage. So the requests and appointments, what we went through for the presentation, but all of those pre-screening questions and those tools are on this other button here on how to apply for WIC.
To be under, so providers, if it'll let me, medical prescription form. That's the medical prescription form. And if I can figure it out, you all can too. I am not good with technology, especially while everybody's watching me. So you go to providers and then click on medical prescription form, and then you would print it out and you can send it. There is a PDF version too, which is on.
Download this one too.
Oh,
PDF
I won't do it
form.
here. And it's just, the name, date of birth, the formula, why you want it. And then I usually just say determined by which dietitian, and then you just sign it at the bottom. That's it. Sure.
There's older versions of this that are still circulating. We keep the most recent one on our website. And it's also dated on the form too. So if you from like 2016 or earlier, please just, again, we have it listed on our website here that you can download and save, but this is the most recent one and that we ask for our providers to submit. But I mean, we will accept an old form, but it does help to use the most current one.
So with this form, you can upload this form onto Find Help. I think is a link that we want to make sure that everyone understands. So once you've completed the form, even if you complete it as a PDF, which I have been doing, then you can upload it directly onto that Find Help portal, and then it goes straight through. So if you're, one of the big barriers for patients staying on WIC is they get very frustrated by all of the communication that needs to happen between the healthcare provider and WIC and back when they're changing formula or food. And so they just decide, I'm just not doing this anymore. And that's why we see that drop off, both in Karen's study and around the country, we're seeing the same thing. So we want to try to make that easier for patients when they do need to make a change, or you feel like they need to make a change. Instead of filling something out, giving it to them, they have to go over to WIC and take it over to them. You can upload it directly into their WIC portal. So even for patients, say they were already enrolled in WIC, but now the child is 6 months old and is having an issue with milk protein intolerance, some version of that, and you're changing them over. I have been trying to just basically re-refer them through Find Help so that I have that communication through WIC. Then I can upload that form, I can make comments on there, they can come back and ask me for things as well. So this form, maybe eventually it will be directly embedded into Find Help, but for right now you do need to fill it out and then upload it. One small technical problem right now is that you need to be on their online portal to upload documents. The one, if you're entering this through Cerner, for I think security compliance reasons, they won't let you upload outside documents into Cerner. Does that make sense? So you can make the referral through there, but if you want to go back in and upload documents, do it on their online, directly on their online portal. Or some people are just using the online portal altogether for that reason, to stay on it, and then you can to kind of take care of all of your work through there. The other thing that I wanted to mention is, this workflow for referring and ongoing communication with WIC. We work very closely with WIC and Find Help to build it out in a way that is usable for everybody. So this capacity for WIC to be able to accept the full referral that you saw, Colton will bring up the screenshots in a minute, but specifically for WIC, for them to be able to receive it and process it on their end, and have the staff and so on their end to be able to follow their incomings on their platform, takes the work of both the community organization and the referral organizations to be able to understand how it works, but most importantly for them to be able to receive and process these referrals. Not all the community organizations on Find Help have that capacity. So when you're on there, it's great to have it. You can search for them. Some of them you can send an email, some of them you can call, and some of them have this capacity for this direct referral. So if you're seeing some that don't have this, that's just because that organization hasn't set that up yet and doesn't have the staffing capacity on their end to manage it. It's still a very helpful platform to get used to find all kinds of resources for your families, whether it's in housing, jobs, food, other things, other food resource agencies as well, at least to know where they are, but not all of them you can do this direct referral. Okay. Colton, you want to come up and show the websites?
Yeah. I'll follow up on a few points here. So there we go. Going back to the slide deck. That point about the sort of document upload going on the platform, what that really means is just making sure that you're using this sort of like external site here, not that integrated platform in Cerner, because of, like, as Dr. Rethi mentioned, because of kind of security compliance limitations with Cerner itself. They don't allow for document uploads in that way with Find Help. So that's why using the kind of staffsocialneeds.medstarhealth.org website to upload those documents is kind of the suggested pathway here. And I'm happy to kind of add that context in a slide too as a resource as well. So just wanted to kind of underscore that piece here for document uploads. The other piece too, did I include it in here? I think I did. I tried to throw in a lot of slides in here for y'all. That piece around different providers having different tools sort of switched on the site, and then I'll kind of dive into these screenshot specific examples. The main thing to emphasize there is when you're using the site, and I believe the materials I'm sharing have this kind of information in the PowerPoint slide. When you're looking at different, I'm just going to type in food, or let's type in nutrition. There we go. So when you're looking at these different programs, right, Find Help really, we do a lot of work to vet and review all the programs we list. Once a program is listed, any worker at that organization has the ability to take ownership of the program. It's free, and it's what enables that organization to use all sorts of free intake tools, access free data reports, all sorts of great platform feature functionality. All that to say, when you're looking at these different resources, it's great to be able to kind of review the information, phone numbers, where they're located, eligibility, what the program provides. Ultimately, though, in terms of connecting with that service, you want to pay attention to this green rectangle. We call this our connect button. And there are a lot of different words on the connect buttons, and that's kind of detailed on a slide that that's gonna be available for y'all as a reference. It's gonna walk through what these different buttons mean. It's to keep it kind of simple. If you see like something that says apply here, refer here, contact here, that's an indication that they have opted into using a Find Help referral tool to receive intake for services. Otherwise, you'll see things like see next steps, and it's just going to reiterate the information you see under here. Really the best way is to go to the location or call the phone number. So just kind of wanted to emphasize that piece too and provide some context for what Dr. Rethi was saying about different organizations having different kind of pathways for receiving intake for services. Any questions there? I know I'm getting kind of in the weeds with this platform, but just want to make sure it's clear kind of how these different things work together. Let me hop over then back to my screenshots just to kind of share a bit more about that specific workflow. When you're looking, as I mentioned here, where these red lines are circled, that's the connect button. If you're clicking apply, like from the website, the DC WIC website, it's going to take you to a full page view of the program, which is why that apply button moves to the top. If you're doing that sort of search version, you're going to see that green connect button is like kind of here on the right. So just keep that in mind, same pathway, just a different access point, if that makes sense. So there's that button here at the top when I click on the full page view of this program. Let's see here. Okay, so I kind of went over this earlier. Let me put this up on as a slideshow format. But I'll walk through it again here because I believe it's WIC specific. This is where you're going to be able to review that initial eligibility. Again, this is that initial contact form. We have like our little comment here that we want the agency to see. We've confirmed the patient's consent. And then, as I mentioned earlier, you'll click next and you'll wait for that screener form to load. And once it does, oh, here's a food pantry one. Yeah, unfortunately, I don't have like the kind of access into MedConnect. Otherwise, I would have made that had screenshots in here or showed that to y'all directly. So it is a little different, but in terms of like the ultimate sort of process and the goal of how it all works together, it's the same. So, oh, see, I did do this as our demo program. That's okay. And I made a note here. So if y'all are looking at these screenshots and referencing these, just note that I wanted to, because basically if I were to click review and submit and make a referral, that is a live referral that is going to that agency, which is why I did not utilize WIC specific programs in the screenshots. I didn't want a referral data point to kind of be tracked in the reporting. But really, all of those different kind of eligibility considerations that Melissa had outlined are reflected in the form. So each different little box is going to have all of the kind of eligibility related questions that the agency needs. And what's cool too is that as you're filling out this form, depending on what answers you fill out, the system's already going to recognize if the patient may or may not be eligible. And so not only is that going to kind of go to the agency to say, oh, hey, this patient may not be eligible for these services, y'all are also going to see that as well. And there's like a little kind of thank you here. As you can see here, mine, in my demo case, based on the situation and info you provided, you may not be eligible for services. So right off the bat, as soon as you're kind of answering those questions and submitting that form, you'll get a notification of whether or not that patient's eligible. The form still goes to the organization if they're not eligible. So just keep that in mind. It doesn't just kind of like close that out, but just wanted to kind of emphasize that too. You'll know right off the bat if they may or may not be eligible for services based on those responses. I want to share a bit more about what the WIC agency can see, just to kind of give you all the context of, where and how this information kind of synthesizes, I guess, whatever word you want to use there. So this is the view of the WIC agency. This is the information they're going to see when you submit that referral for that patient. They're going to have that referral status we talked about right there on the left. They're going to see all of the information about that patient right here, including their preferred language, their preferred contact method, along with contact details. I was using my personal phone number, so I'd block that out. They're going to see who referred that patient. So they're going to know, okay, and they'll see, like you're seeing me as Find Help admin. I believe that, depending on what system you're logged into, and especially with the kind of Cerner integration in that MedStar specific staff site, they're going to kind of see that reflected under your name, if I'm correct there, I'm pretty sure. We'll see the referral date, when it was last updated and who updated it. And then they'll be able to view that comment you made. And in this case, under forms, they would be able to view the click directly into the screener that you filled out. And again, all this stuff is like kind of outlined for you down here. So you have that as a reference for after today, if ever you need to kind of have another visual or a reminder. I'm going to go back into tracking here just to kind of reemphasize this piece too. Again, going back into people, it's going to be a similar dashboard view for the agency. So in addition to Community of Hope, Children's National, Mary Center, and Unity, all having this kind of inbound referral view, they are also going to be able to go into their People I'm Helping dashboard and see all the referrals that have either been made to their programs for that individual, or any referrals they have made for that individual outside of the WIC specific agency. So I know that, we kind of went through and talked about this already. Again, what I want to emphasize, it's a very similar view for the agency. So this is what they would go into to communicate back and forth with y'all. If you added a note and you were saying, okay, why was this person not eligible for services? Like I filled it out, blah, blah, blah. You could add that note and the agency would have that view of that specific note in that referral. So again, it's that bidirectional communication piece. What I want to emphasize here is the referral status updates. You have the ability to update the referral here. The organization has the ability to update the referral in their inbound referral dashboard, as well as here. Any update that you or the agency makes is going to update for both of the records. So it's a very similar dropdown of referral statuses that the agency would see in that other view I was showing you earlier with all the arrows kind of pointing up. It's the same kind of referral statuses here in this People I'm Helping view. And again, the main thing to emphasize is that no matter where you click to update that referral, it's going to update across the record. So right now I kind of have this at, what does it say, got help? But let's say that you went in and you were like, actually, they didn't get help. You could go in and say, couldn't get help. And then that would update for the agency as well. So it helps keep everyone aligned on the kind of ultimate outcome of that referral. And this is also tracked in a whole host of different data reports too. Talked about this, just reemphasizing again that bidirectional communication stream with the note feature here. And really ensuring that you're clicking this status here to make note visible. If you don't check this box, that note is just going to stay internal for you. So the agency won't see it. If you have comments or notes that you want to make about the patient that you don't want shared externally, leave that box unchecked. But if you want to communicate with the agency, check that box and then click save, and it will be visible for the agency as well. I think the last thing here, I guess there's a few more things here. You'll be able to see the kind of entire record of those status updates and the different comments and the different notes directly in that referral view here. So in this example, I made a note that, hey, I saw the comment about, Willie living with the grandparent. Wanted to make sure that I saw that. So I commented, I made a note that the comment was received and that I provided that assistance on that date. I can also see the entire kind of record of when referral statuses were updated and by whom. And then lastly, if ever you wanted to go back to revisit any screeners that you've submitted, whether it's for WIC or any other agency that has a screener form enabled on the Find Help platform, you can directly go into, on the left-hand side under forms, you'll see screeners. And from there, you can view all the screeners you have made for that patient and submitted to WIC or other agencies, depending on their sort of functionality on the site. But all that stuff, again, is stored here. And when you're uploading documents, like that medical prescription form, for example, that information would also be found there's like a document section I think I showed you earlier. So forms, think of forms as like, these are where I can find help, like screener information. Documents would be where you'd find any uploads you've made or any uploads you want to make to the patient's profile in the Find Help platform. Is that a, yeah?
Yeah. Well, I actually have one more question for you.
Sure.
You said that the patients themselves are getting confirmation of the referral.
Yes, so when a referral is made for the patient, depending on the notification method you've specified, they will get notified as well. If that information had been updated in an email exchange, then they would also get notified that the referral has been updated.
So that's good, keeping your patients in the loop with the referrals that you're helping them with. So thank you very much again to all of you for participating, and particularly to our partners for coming today and for sharing this wealth of knowledge, and also for your partnership in this project. And of course, to Dr. Ganesius for her outstanding work in leading this project all the way through. I do want to just end, since it is for our primary audience here is our learners. I hope, in addition to the material that you learned about WIC, about Find Help, and about technical things on referring your patients in a way that's effective and hopefully feels good and feels comfortable for your patients as well. I hope you can just kind of see a little bit of the larger picture of what we do in community health and population health, sort of from beginning to end. And this is as a little bit of a case study for you. This is an organization, a program that we know provides tremendous health benefits for moms and babies, and can contribute to decreasing these disparities that we see here in DC and around the country. And Dr. Ganesius recognized a big gap in utilization of that program. And her research took her from trying to understand those gaps, doing needs assessments with all of the stakeholders, including parents, WIC staff, and pediatricians. I think some of you guys did her survey as well. And from that research, identifying where those gaps were and potential places to address those gaps. And it turns out that in order to do this, it was a technical solution that involved really collaborating closely with all of our partners, and using that input that she got from all of the stakeholders to come up with a solution that we'll see and hope will ultimately decrease health disparities here in DC. And so, as you go on your journey as a pediatrician, as a healthcare provider, with these identifying some of these gaps that you're noticing toward optimal health for everybody in our community, that there is really a systematic way to understand these problems better, develop these very strong working relationships that Karen has with our partners over the last couple of years, and then coming together with a solution. So I hope that inspires you as well on your journeys to look around, see what's working, what's not working, and approach these in a scientific and collaborative way. So thanks again. Enjoy the rest of your retreat.